On May 25th, in Minneapolis, Minnesota, 46-year-old George Floyd died while handcuffed on the ground after police officer Derek Chauvin pressed his knee into Floyd's neck for nearly 9 minutes. During this time, bystander video footage showed Floyd repeatedly crying out, "I can't breathe," until going unresponsive. In the minutes following, medics arrived at the scene and found no pulse. An hour later, Floyd was pronounced dead at a nearby emergency room, according to the Minneapolis Fire Department incident report. This murder of an unarmed and unresisting black man in broad daylight has led to international outrage and sweeping protests, demanding an end to police brutality and racial violence. Chicago resident Gary Walker took part in these marches and rallies, as well as helped clean up businesses that were damaged from violence and looting. Walker is a young black cinematographer that's lived in Chicago for much of his life. On May 30th, he filmed the first mass protest in the city in response to the death of George Floyd.
I met up with some friends of mine, and I was just expecting to go down and shoot an event. Like, I've shot tons and tons of events before this. I kind of have an idea of how they usually go. I've shot parades and protests before, but something changed when the cops started to push the line a little bit, and then people started to push back, and then the cops started advancing, and then all of a sudden we're running next to the Chicago River, and the cops are just tailing us, guiding us along the entire time.
Walker says the initial peaceful protests escalated quickly into a chaotic scene. But in that moment, he was determined to capture the unfolding events.
There's a bit of a paradox when it comes to being a filmmaker and being black, because on one hand, I should be afraid, and there are moments in my life where I am afraid and I am looking in my rearview mirror constantly about police. But the moment I have a camera in my hand, it's an obligation. I feel like I have a duty and an obligation to film and document and capture what's really happening. So a lot of times I feel like my personal well-being gets put to the side.
Another danger to the health of Walker and the millions of other people and police who showed up to these protests is COVID-19. The pandemic has dominated headlines in the U.S. since mid-March and is still a looming threat even as states continue to reopen in phases. Walker says he's aware of the risk, but that the continuous killing of black people by police with little to no accountability is also a public health crisis, and one worth showing up for.
I can't justify sitting down and letting these things happen while I have an ability to do something about it, you know? I mean, at the end of the day, COVID is a personal thing. If I get sick, then I get sick. So on one hand, it is selfish for me to think that I should be out there and I should be fighting for this, because I do run the risk of bringing it back to my parents, to my grandparents, to my family, to my friends. But if you're conscious about it and you're isolating yourself as much as possible, you should be able to be on the front lines without any problem. And it really comes down to, I'm willing to make that sacrifice so that my kids don't grow up in a police state. I think as young people, we have that duty because we are at less of a risk of dying from the virus.
Walker's viewpoint is justified. According to a 2019 study published in the scientific journal PNAS, 1 in 1,000 black men can expect to be killed by police in their lifetime. It is one of the leading causes of death for young men of color between the ages of 20 and 35 years old. The data-driven advocacy group, Mapping Police Violence, also reports that on any given year between 2014 and 2019, police killed more than 1,000 people across the country. In these cases, nearly 60% of victims didn't have a gun or were involved in harmless activities. 15% of those shot were going through a mental health crisis when officers were called to the scene. Despite the large number of situations where lethal force appears unnecessary, internal reviews overwhelmingly side with the officers involved, and 99% of these killings by police did not result in officers being charged with a crime. This high number of killings by police is by no means normal across the world. The UK advocacy group Inquest says that in the 25-year span from 1990 and 2014, there were a total of 55 fatal police shootings in England and Wales, less than what we see in an average month in the United States. In Germany, Australia, and Canada, the number of killings per year are all in the single digits. While the death of George Floyd sparked global anger, It's another name to add to the long list of unarmed people of color who have been killed at the hands of police.
Racism is an undercurrent and has been an undercurrent of the sense of Black people in America for hundreds of years. I think we are faced with microaggressions, and then we are faced with macroaggressions. What we witnessed with George Floyd was a macroaggression. It was the pictorial illustration of all of the metaphors and anecdotes that we speak of very freely in the Black community, that America, that racism has a knee on our necks. And so I think it was the visual illustration of that, and actually watching someone die that way. Another colleague of mine actually described it as a modern day lynching. And for a generation of people, of millennials and even younger, who have never experienced a lynching, who have read about that in textbooks, who have seen horrifying pictures of it, but that is what we experience.
That's Dr. Lauren Powell, a social epidemiologist and public health leader who's been recognized for her work in furthering racial and health equality. Previously, she served as the director of the Office of Health for the Commonwealth of Virginia. She's now the executive director of the not-for-profit organization Time's Up Healthcare, based in Washington, D.C. Powell points out that COVID-19 has further revealed racial inequalities by disproportionately affecting communities of color.
Knowing how many people are sheltered at home, quarantined at home, self-isolated, and or working on the front line still in low-wage paying jobs, in jobs where they don't have the privilege of paid sick leave. There's so much frustration. People who've lost their jobs, people who cannot pay their rent right now and are hoping and praying that they won't get evicted. And how do we protect people who are already at heightened risk because of the impact of racism on the social conditions that create our health conditions? How do we keep them safe? So you just end up looking from the left to the right. It feels like we can't win for losing. And people are rightfully outraged.
It's a complex issue. The economic disparities that emerged from hundreds of years of racism have pushed African Americans into positions that make them more exposed to the virus. Powell says many hold jobs in grocery stores, restaurants, and other sectors of business that are deemed essential throughout the pandemic. On top of that, factors like cramped housing that constrain social distancing, limited access to health care, as well as a lack of benefits like paid sick leave have all contributed to the spread and increased mortality of the virus.
Conditions like asthma and hypertension and diabetes are all more prevalent in communities of color and are risk factors for complications with COVID. And so now you've got multiple layers of just the way that society has been constructed that impact and that build upon the disproportionate impact of COVID-19 on the Black community.
And the nationwide data reflects these inequalities. As of late May, the CDC reported that 30% of confirmed COVID-19 cases in the U.S. are African Americans. Yet the group only makes up 13% of the overall population. In Chicago, 60% of COVID-19 deaths have been Black, despite accounting for only 30% of all residents. Our country stands at a crossroads of multiple crises that have disproportionately hurt minority communities. And for many people, sitting on the sidelines is no longer an acceptable option.
The public health side of me knows just how dangerous this virus is and who it seems to impact the most. I'm very concerned. And at the same time, there's never a convenient time to dismantle racism. So a pandemic is certainly not ideal, but it's also the root of racism that is even the common golden thread here, if you will, between the impacts of COVID-19 and the George Floyd murder. It is the root of racism that has made this such a heavy, heavy burden for the Black community.
If you do choose to attend a rally or any large gathering in the coming weeks, take the recommended precautions. Wear a mask, bring hand sanitizer, and socially distance whenever possible. To support research that works to end police violence and injustice, donate to the advocacy group Campaign Zero at joincampaignzero.org. Find out more about our guests, Gary Walker and Dr. Lauren Powell, at viewpointsradio.org. For more behind the scenes, check out Viewpoints Radio on Instagram, Twitter, and Facebook. This segment was written and produced by Amira Zaveri. I'm Gary Price. Coming up on Viewpoints.
I don't have that security anymore. I lose this business, I lose everything.
The balancing act for business owners in this economy. Then,
don't expect to be an expert right away. It doesn't come easy, and that's part of the joy of it.
Grab a glass of wine and get comfortable. I'm Marty Peterson.
and I'm Gary Price. These stories in depth on your public affairs magazine, Viewpoints.